As a radiation therapist here at Duke, we both we treat cancer patients with radiation. We're the ones that actually give the radiation to the cancer patients. The doctors, physicists, and dosimetrists create a plan, a treatment plan for the patient, and we're the ones that actually administer the radiation to the patient. I got into radiation therapy originally by starting in the X-ray program. Did that 2-year program, got to do some clinical rotation in the radiation oncology department.
I got into radiation therapy several years ago. I worked at a private radiology office in Raleigh as a medical secretary, and I decided after working there for 8 years that I wanted to go back to school to be an X-ray technologist. Years ago, I decided I wanted to do something in the medical field, but I did not want to spend the rest of my life in school to be a doctor, and I felt like nursing wasn't necessarily the profession for me. So I did some research and decided to go to school for X-ray, and then through X-ray school I heard about radiation therapy, and so I went to 2 years of X-ray school at Vance Granville Community College, and then I did 1 year of radiation therapy school with Pitt Community College.
My story is kind of similar to Jennie's. I got into radiation therapy through going to school for X-ray. I did that for 2 years, did some clinical rotation in radiation therapy, worked as a X-ray tech, and then went back to school for radiation therapy at Armstrong Atlantic State University in Savannah, Georgia. Then I came here, and that's how I got here.
My first job out of college from radiation therapy was here at Duke.
My first job out of radiation therapy was also here at Duke.
Some of the stresses that we encounter day to day is having to schedule somewhere between 30 and 40 patients in a day, trying to satisfy and make all of our patients happy with their schedules, taking into account that many of them are from out of town or out of state, and sometimes even from out of the country. So we try to do our very best to do what we can to help them with their scheduling needs, but it becomes very stressful sometimes when you're scheduling anywhere between 30 and 40 patients and juggling that on a daily basis. The positives of this job are the patient's appreciation and gratitude for what we do for them on a daily basis. Anytime you can get a smile or a laugh out of a patient, it really makes your day.
I enjoy my job, and I would suggest this career to somebody who is wanting to make an impact in somebody's life. We're a part of their journey, fighting cancer. Just being there for the patient day to day, giving them a smile, and just being there for them, someone to talk to and get them through this process.
I feel that my role here at Duke is important because I play an integral part in a patient's life from anywhere upwards 5 to 6 weeks on a daily basis, and we are responsible for giving these patients love and support and compassion that they need to help them get through a scary process in their cancer journey.